Hello, and welcome to podcast episode 2, which we will focus on the 5 C's of nursing. The 5 C's of nursing include compassion, curiosity, corresponding, commitment, and competency, and they provide a strong foundation for delivering safe patient care. While each of these values is important, I was particularly interested in exploring how they work together in everyday nursing practice rather than existing as separate concepts, and go on to impact how the public perceives the profession. As a new grad nurse, it can be really easy to become focused on completing tasks and managing a busy workload, and that sometimes comes at the expense of slowing down to fully connect with patients. Reflecting on the 5 C's has encouraged me to think beyond simply providing treatments, and rather consider the type of nurse that I want to become. So these principles remind me that technical skills are only one aspect of nursing, and the way that we communicate, learn, and build relationships with others is equally important in promoting positive health outcomes that we're looking for. I feel like the 5 C's greatly impact public perspective on the nursing profession because of the different archetypes that we see nurses fill in the media, and I feel that's often in part to the 5 C's. Often they're seen as like selfless angels or superheroes, and we see some of this imagery in that concept of the lady with the lamp from Florence Nightingale, or in the artifact that I provided. There is an art piece there by Banksy, and it's a child playing with like a nurse doll as if she was a superhero. So I feel that those concepts of the 5 C's of nursing also impact how the public perceive the profession. Throughout my research, I found that compassion consistently improves the patient experience by helping patients feel heard, respected, and valued. Curiosity encourages nurses to ask questions, seek evidence, and avoid making assumptions about a patient's condition or circumstance. And this concept of curiosity is heavily encouraged in the article that I have linked, 2025 article by Dickinson. Corresponding or effective communication allows nurses to collaborate with patients, families, and the interdisciplinary team while reducing the risk of misunderstanding and medical errors. Commitment reflects a dedication to lifelong learning and advocating for patients. And competency ensures that nurses possess the knowledge and clinical skills and judgment necessary to provide safe and effective care. Competence is one of the greatest protective factors against disability and death, as evidenced by the 2023 study I have linked by Zaytoun et al. Although each of these values can be discussed independently, the literature suggests that they are deeply interconnected and collectively contribute to better patient satisfaction, stronger therapeutic relationships, and improved clinical outcomes. What stood out to me most during this research was how practical the 5 C's are and how they can be incorporated into almost every patient interaction. Compassion can be demonstrated through small actions like active listening. Curiosity can be involved by asking additional assessment questions rather than just accepting the first explanation we hear. Commitment can look like taking time to reflect on clinical experiences and seeking feedback. Competency, it takes time to develop through ongoing practice, but it also includes critical thinking and applying evidence-based interventions. Relational inquiry strengthened my understanding of the 5 C's because it emphasizes that nursing care is influenced by the relationships and context surrounding each patient. Compassion allows us to appreciate the patient's lived experience, while curiosity engages us to explore social, cultural, and environmental factors that can be impacting our patient. Corresponding supports meaningful therapeutic relationships by promoting open dialogue and understanding. And commitment reminds us to advocate for our patients despite challenges within the system, and competency ensures that our clinical judgment is informed by current evidence. Relational inquiry encourages that nurses recognize every patient interaction is shaped by these broader concepts rather than focusing solely on a diagnosis or a treatment plan. And as I continue to develop my nursing practice, I hope to intentionally incorporate the 5 C's into every patient encounter. I recognize that a lot of these take time and will grow through experience. These qualities will not only help me provide safe care, but they'll also have me build trusting relationships with patients and families. And I believe consistently practicing the 5 C's will improve patient satisfaction and outcomes and help me become the kind of nurse that I want to be. Thank you so much for listening.